technological advancements which are happening in our physiotherapy and neuro rehab technology. So I'm going to present you some latest equipments. It won't be boring, believe me. It will be very interesting, and I will just take 5 to 10 minutes of yours. So my topic is modern advancement in physiotherapy and neuro rehabilitation. Let me tell you about us. We are 2002 we established, and we are working in physiotherapy and neuro rehab field from past 21 years now. We are one of the leading manufacturer and exporter of physiotherapy and rehab equipments. We are situated in Delhi, but we have multiple offices, and we also export to SAARC nations. About the technology, like Dr. Raju sir told us, that technology is very adaptive. We have to get adapted to the technology. Earlier, we used to have the bulky telephones, as in 1885. Then slowly, gradually, we started, and now we have smartphones. And maybe in future, we have something in our hand through which we can make the calls and everything. Now we have more convenient, portable, and multitasking phones which we are using. Same way, the physiotherapy has also been evolved. From research, it has become a physical application. From theoretical, now it is more of a practical application. And from post-surgery, now it is a pre-surgery also, a preventive surgery therapy. Same way, in earlier, the traditional gait training therapy, it was used to on a parallel walking bars along with the assistant physiotherapist. Now they converted it to a robotic gait trainer, but that is also a decade-old technology. Now exoskeletons are coming in the picture. The reason being that mechanical stimulation over an exoskeleton, if a person is walking or climbing the ladder, he will get much better brain relearning nerves than as compared to a normal locomotive therapy. So who can benefit from the exoskeleton? The exoskeleton, it's a locomotive gait therapy. And the patients who are suffering from spinal cord injury, stroke, multiple sclerosis, brain injuries, CP, Parkinson's disease, and some other neurological conditions can be benefited through exoskeleton gait therapy. The main effects of exoskeleton, it restores the motor control, helps in the load management, helps in relearning the muscle memory, and global mobility is restored. Apart from the mobility, it increases range of motion, helps in postural control, increases muscle and bone density, also helps in respiratory disorders. It decreases spasticity level of the neurological patients, and some other benefits are there. Here's a small video for you. So this is an exoskeleton with full robotic gait system. We have recently installed it in the Udaipur, Rajasthan. It comes with inbuilt FES. It's the only exoskeleton or a locomotive gait therapy which comes with inbuilt functional electrical stimulation with myoelectrography, and it comes with a full lifting mechanism. So patients from hemiplegic, paraplegic, quadriplegic all can be performed or can benefited from the exoskeleton e-helper. Then we also have virtual gaming provision, and it comes almost half the cost of what the bulky traditional robotic gait trainer comes. It comes with 8 channel and 16 channel inbuilt FES. The motors, the power, it evaluates the spasticity level of the patient and it changes the motor power accordingly. Apart from that, it have the muscle activity control and electromyography, so you can make a predefined protocol for the patient to patient. Then you can have the walking, you can have the marching, you can have the stair climbing, you can have the stair down, you can turning, incline, decline. 8-hour battery backup is there. Now the main thing which the EXO, how it is different from the others, it can be controlled by 5 factors. One is wireless hand controller. One is buttons in the crutches, which the crutches the patient do have, so the buttons are there in the crutches. A balance shift mechanism is also there, so it also have assistive passive mode. So with the balance shift mechanism and femoral muscle activation, it can be used as an assistive passive mode also. Wireless tablet is also there through which you can control the exoskeleton. FES and electromyography is there. Here's a small video. This is the exo, and this is the full robotic gait system on your right side. The treadmill which it do have, it starts from 0.1 kilometer per hour. It can be controlled by the patient heartbeat also. There is a sensor, polar sensor, which controls the treadmill speed through the patient heartbeats. It starts from 0.1 and it have adaptive speeding. So if the patient is walking fast, the treadmill will walk fast. If the patient is walking slowly, the treadmill will walk slowly. Here are some differentiation between exo and the other exos which we have. We have inbuilt FPS, electromyography, harness system, virtual reality. Patient load capacity is 110 kg. It have up to 8-hour battery backup. And paraplegic, hemiplegic, quadriplegic. All kind of patients can be treated on this because it have the lifting system. If you are using a normal exoskeleton, then in that case only a paraplegic patient can be treated. Lastly, in a general approach to a treatment, first, when a patient comes to the clinic, we find the source of the problem, right? That can be found through patient feedback, through MRI, X-rays, visible approach, and other conventional methods. Then we do the treatment for the patient through electrotherapy, manual therapy, other kinds of therapies also. Then we get the patient feedback. After the treatment, we get the patient feedback to ascertain how the therapy was, even if it was effective or not. Now, what if I tell you that all this can come under one modality? That machine is called PulseStar. It analyzes the issue, it treats the issue, and then it post-screens the issue to see the results on a real-time basis. The PulseStar part 1, it analyzes the spine. It tells you where are the dysfunction between the vertebrae. It tells you where are the muscle weakness, misalignments, nerve compression, whether it's a spasm muscle, stiff muscle, or a weaker muscle, any kind of vertebral issue. So it detects those issues. And in second part, it treats also. So it works on multiple impulse therapy. Multiple impulse therapy is basically small adjustments which mimics your manual adjustments, but in a much better way. It ranges from 5 force pounds to 35 force pounds and can go from 0 to 90 hertz per second. Now when it goes to 90 hertz, it breaks the 80 hertz barrier. Dr. Golgi tendon complex theory of 80 hertz barrier, it breaks that barrier, and in return our nervous system releases that area. So if anyone have chronic trigger points, nodes, it can release that immediately. It can be used for almost all kind of musculoskeletal issues. It is very beneficial in preventing surgeries also for the back. That's its main purpose. So musculoskeletal issues, spinal issues, plantar, vertebral, frozen shoulder, tennis elbow, golfer elbow, any kind of musculoskeletal issues there, the machine can come to play and it can resolve it. It compares the pre and post treatment. It have a detailed printout. You can hand the printout to the patient, and he can also have a feedback, right? That before the treatment, this was the issue, and after treatment, the issue has been resolved. So patient also get a psychological satisfaction over there. Here's a small video.
PulseStar Musculoskeletal Innovations revolutionizes the treatment of chiropractic conditions. In the hands of a skilled chiropractor, the PulseStar essentially eliminates the cracking, popping, and twisting that's often associated with chiropractic treatments. When a patient comes in for their first visit, the chiropractor will do what's called an analysis of the motion of their spine with the PulseStar.
By analyzing with a small constant energy impulse at each vertebral level, we generate a plot of the stiffness of the spine that we can compare from vertebra to vertebra.
The impulse head itself will record the information that it gets from the movement of the spine, and it will display that as a bar graph. The bar graph has different colors depending on what might be going on in that area of the spine, If the bars are yellow, there may be some muscle stiffness in that area or muscle tightness. If there are intersegmental red bars, that shows that there's a dysfunction between two vertebrae.
You then diagnose the patient and decide whether to apply multiple impulse therapy with the instrument. Multiple impulse therapy is many small adjustments that are designed to mimic your manual adjustment, except that they are much lower in energy. Multiple impulse therapy acts really in two ways to relieve the patient's pain. The first is balancing of the nociceptive and proprioceptive system. And second is the release of the contraction of the muscle through stimulation of ATP and provision of a uniform interstitial solution of electrolytes. The post-analysis, when it's compared to the pre-analysis, provides visual reassurance and objective reassurance to both you and the patient.
The patient and the doctor can see the results of the adjustment in real time on the screen.
It also enables you to show the patient what remaining problems there may exist so that you can justify the patient returning for the next visit. In addition to...
So that's it. Our booth is also there, and our website is www.biomedindia.net. If anyone is interested in the products and they want to know about the new advancements, we are always happy to welcome you. So that's it. Thank you everyone for your time.